Mike Nurse Talk Show. I want to tell you today is a very, very good day. We're appealing to our government through federal, through the municipal and private sector to execute a plan that I put in place where there's a national opportunity for home care and nurses to develop all of the new and highly technical equipment to come right into your home. Some homes, as I said in previous episodes, may not be equipped to handle home care, but home care is definitely the way to go. It's less expensive than placing family members in homes, and the whole transition process being so convoluted. We also are here in New York, based in the Bronx, and we are an innovative, very successful company growing from the grassroots within this nursing profession. We are looking to expand throughout different states and different cities to bring professional registered nurses into your home on a longer basis, not just for a 2-hour interim to do an assessment, but to give long-term care. We'll be asking new graduate nurses some basic questions on the reasons why they went into nursing, why they wanted to become a nurse. Do they feel that the nursing program that they went through prepared them very well? Were the nurses that they watched and worked with within the hospital that were already staffed there for either a year or more, more seasoned nurses, whether or not they felt that they were comfortable with those nurses, were those nurses welcoming? We also asked questions to these nurses if this was a career change for them, meaning since they've been hearing in the media that nursing is a secure field, that they make all this exorbitant amounts of money, or was it a calling? Was it something that you like doing? You like working with people? You want to see people who have been very ill recover? Or what was it that made you make this career change? One of the other questions were the hospital was the hospital itself paying for your schooling? Were they involved in wanting to retain you after you graduated? Were you in those types of programs? What is the specialty that you're looking to get hired in? And the last question was, would you relocate to work in another state or province or country if there are no jobs here in the United States? We had a lot of different answers to these questions, but I remember when I graduated, there were no jobs in hospitals unless you had 2 years med-surg experience and were unable to find jobs. I was one of them, and the only way to work was to work in a nursing home. The requirement was that you needed 2 years med-surg experience to work in a hospital. None of us had that. We had to take the nursing home jobs, and the nursing homes, when they staffed the nurse was required to do supervision and give out medications and do treatments to 50 patients at the least, sometimes more, which was unrealistic. Needless to say that that did not last long with me because I couldn't see giving care that way. I found 1 out of 10 nursing homes to be proficient in giving care and that I would trust to have a member of my family or yours placed there. Unfortunately, many people cannot keep their families at home, but hopefully we will be able to appeal to our government that it is a lot less expensive and a lot less labor intense for the family to be placed, to be able to stay in their home than to be placed in any outside facility from their home. They're paying mortgages, they have to worry about spending down, and these stresses can cause major complications with finances and emotionally and physically. Those emotional instabilities can turn into physical problems. So we'll take a break and then we'll come back and we'll answer some of these questions. Welcome back to today. We're going to talk to a nurse through Skype. She is a community health advocate, and she decided to go back to school. This is a career change for her. I don't know if it was a professional career change or not, but I do know she definitely got into this because she wanted to help. That was her reason for getting into the healthcare industry. So I want to introduce to you Meryl Curio, and she's a graduate nurse, and she will elaborate on those questions that I have asked her. All right, Meryl. What made you want to become a nurse, Meryl?
So what made me want to become a nurse is I'm definitely a people person. I enjoy working with people. I've been in healthcare for over 10 years, and I thought I'd put it up a notch by becoming an RN.
Meryl, do you think your educational needs were met?
Educational needs were very much met. I very much enjoyed my nursing program. I had very knowledgeable, intelligent, experienced professors, and definitely learned a lot from them. And I want to make them proud.
Do you think you're ready to take your nursing boards?
I'm actually currently, I did graduate from nursing school. I am studying for my nursing boards. I feel almost ready. So I will be taking them hopefully soon this year. I don't want to wait too long.
Do you feel you're ready to practice as a nurse?
I consider myself a nurse, but of course I'm not licensed yet, but I do have the nursing mentality, because currently I do work as a healthcare advocate, but I'm not an RN, not in the capacity of an RN.
Was the hospital rotation what you expected?
My rotation at the hospital was excellent. It was awesome. It was very hands-on patient care. My clinical professors were excellent. I learned so much from them, and I am so grateful for having them as my clinical professors. I learned a lot. I was of course supervised with patients, doing assessments, interviewing. It was really a great experience. It wasn't easy, but it was a great experience, and I definitely enjoyed it. And it's definitely what I expected.
Will this be a career change for you?
Well, for me, being RN is sort of bringing it up a notch into my career, because I've worked, like I said, in healthcare as a health educator. I worked in the HIV fields. I worked in public health, and I have tech certifications, medical assistant or tech, phlebotomist. So it's sort of like in the realm of course, nursing, but it's not an RN. So it'll still be more or less in the field, but of course, taking it all the way in RN.
Were the hospital staff nurses helpful to you?
The hospital staff nurses were actually very helpful. Everyone was very compliant in terms of answering questions that we had, willing to help. They were great. I mean, they never, any problems. I find that nurses are very helpful with each other, and they do want you to succeed, and of course offer the best patient care.
Meryl, what specialty in nursing are you looking to get into once you're hired?
I am not sure yet in terms of specialty. I would like to do med surg for about 2 years, and from there see where I want to stay at, specializing. Because I haven't worked as an RN as of yet, so I can't really say about specialty. But I would like to do work in med-surg for at least 2 years.
Are you willing to relocate if you cannot find a job here?
Most definitely. I lived in Florida for many years, actually, Miami Beach, and I might want to move back to Florida. But I do want to finish my license here, because I finished my education here as a nurse. But I probably would like to move back to Florida, yes. Right now, but pretty soon.
I want to thank you, Mario, for answering all those hard and difficult questions. So today we also want to show you where we went out into the field where they're closing hospitals. They're going to close some hospitals in some areas in Brooklyn that really, from what some of the staff were saying, should not be closed. Some of the staff in one of the other area hospitals that are legislated to close in the Atlantic Avenue area, they feel as well should not close because of the type of clientele that they have, but the hospital itself needs funding. Welcome to the Mike Nurse Talk Show. We're going to be interviewing two retired attorneys in front of the Supreme Court State Building where the protest was to begin today towards the Supreme Court and interviewing two attorneys. Can you state your name?
Hi, yes, I'm Mary Fouts.
Mary Fouts is a retired attorney, and Mr.
Seth Greenwald.
Mr. Seth Greenwald. Mr. Greenwald is also a retired attorney. They sent everyone home that was out here earlier because of the postponement. Can you tell us about that?
Yes, we were here to protest the sale of Litch, and there was supposed to be a hearing this morning, but it was postponed until tomorrow, so there'll be a protest tomorrow morning, we're told, at the same time, about 9 o'clock.
Well, the court hearing on the closing of Litch, not just sale, closing, was scheduled for this morning, but then the court, I think, adjourned it one day to tomorrow, Friday morning, so that the protest, this is to support the people, keeping Litch in operation, because the neighborhood really needs it.
There's also one other hospital, I'm told, to be closed as well. Interfaith Medical Center, is that correct?
I don't know for sure.
No, I know about that too, because I originally lived in Crown Heights, and it's called Interfaith because it joined the Episcopal Hospital and Brooklyn Jewish Hospital joined up. Brooklyn Jewish was closed and sort of merged into Litch in a new building on Atlantic Avenue. But as I say, there's been a steady closing of hospitals in the inner Brooklyn downtown area. There was, I think, on Albany Avenue in Bed-Stuy, a St. Mary's Hospital, and it closed about 5
I think it's St. John's as well.
But I'm just saying that there's been an attrition of hospitals in downtown inner Brooklyn for years and years, and it basically should, I think has to stop.
Right.
Because the last, as one who lives right here, we live up at Cadman Plaza, and if Litch closes, well, I always say, what's the closest? I think I have to go to, what's that, Beekman downtown, across the river. That's the closest place.
Thank you for expressing your thoughts and your feelings on this. We will be coming back to you tomorrow. Again, tomorrow it'll start at 9 a.m. and we'll interview some of the nurses. We'll interview some of the patients as well that are willing to describe how important it is to keep the hospitals open for their safety. Thank you. So we can be reached at Transparency and Registered Nursing. And our address is 890 Garrison Avenue in the Bronx of New York at 10474 on the second floor in the Sunshine Suites. Our telephone number is 212-281-9715, or you can watch us every week on www.bronxnet.org and click on Channel 70 at 9 p.m. every Wednesday between 9 and 9:30. I want to thank you and God bless.